Hello, hello, hello. Welcome, everyone. See people just popping in. It's good to see some of the regulars on here.
Audio. Okay.
All right. Hi.
Yeah. Hey,
It's good to
you
see
got it. All
y'all.
right.
All
All
right.
right.
Good
Well,
to
this
see
way,
you.
please. All right. Okay.
All right. Good to see y'all. Okay. Welcome, everyone. We'll go ahead and get started. I'm going to keep an eye. I see some people joining, so you may see me look over and keep letting people in the waiting room. Welcome to our monthly webinar. Uh, my name is Bridget Wallace. I'm your host, and I'll be facilitating today. I'm the owner, I'm a physical therapist and owner of 360 Balance and Dizziness here in Austin. I was just had the opportunity to talk to Dr. Chavez, and who's also been in the Austin area for a while, and we're celebrating over 22 years here in Austin. So uh, I'm going to do a couple of housekeeping items, and one of those is just as we get started, keep your microphone off. You're more than welcome to turn on your camera, unless you think you might be walking around with your phone or have a ceiling fan in the background, because that can make some people dizzy that may be watching. So without further ado, I would like to turn the floor over to Dr. Chavez, who is a board certified internal medicine practitioner and functional medicine practitioner. I had the opportunity to learn about her in this specialty that we're going to hear about today. Actually, I'm sorry, I'm letting people in the waiting room from a patient, and who just raved and raved and raved about the experience and how it helped them with their dizziness and their balance. And this is certainly something, this gut to brain, that comes up in our practice consistently, whether it's related to inflammatory, people with chronic dizziness, balance, poor sleep, elevated sympathetic nervous system responses. There's just neurological disorders. It just goes on and on and on. And so this is a real honor. I don't happy to turn the floor over and let Dr. Chavez tell her a little bit about herself. She may want to share a little personal journey and how she ended up here. And then we'll get started with, I have a handful of questions to ask her.
Thank you, Bridget. First of all, I'd like to thank you for inviting me to this webinar. I think, any opportunity to learn, because I am definitely a person who loves to continuously learn, and I learn from all means and people, and it's just great to be here. Great to be here with everybody as well. I'm Dr. Valerie Chavez. I started out my career in primary care in Round Rock. Then I moved to Austin. I did 8 years of primary care medicine, and I got sick. I had my own gut issues. I had just symptoms that made it really difficult for me to practice. And that's kind of how I stumbled onto functional medicine, where it's talked about getting to the root cause of what's going on with you. There was another practitioner who said it best, where in functional medicine, instead of just, treating pain, like say if you're walking around with a pebble in your shoe, you can treat that foot pain, or you can just take the pebble out of the shoe. So that's kind of what functional medicine does. And we work a lot with supplements, but I've also taken my practice to a different area because I'm more of a minimalist, and I love to make sure that only the most necessary measures are utilized, just because it can get pretty overwhelming with tests, excuse me, with tests, with cost, with things to do in an already busy life. And a lot of folks can already be overwhelmed with the whole, just so many things to do. And so I think minimalism for me is the way I practice best. And I love to really work with folks. I practice in a different way, not just in regard to the type of wellness that I practice, but also I like to make sure that, it's more of a team approach. Back in the day, I think, as a physician, I was pretty good at just talking about what patients had to do. And nowadays, I really like to see where patients are coming from, how they feel, and see what their gut instinct tells them, because I'm here to guide, but I'm not here to demand anything from anybody. So it's a different approach, and I've learned some things just from practicing in my minimalist practice, which I enjoy. But I will turn it over to you, Bridget, and I'm happy to answer any questions as well.
Well, thank you so much again. It's such an honor to have you. So I'll start off with this question. There's just a growing amount of literature that references the gut-brain axis, or GBA. So can you tell us a little bit about, tell our listeners what that means?
Yes, absolutely. So in regard to, just the gut brain connection, I mean, I think it's understood that, our bodies don't function just as separate parts. They all work together. And when you think about the gut, it's responsible for so many things. About 70% of the immune system is located in the gut. So we have things like neurotransmitters being produced, which can affect our mood. So if somebody has a gut issue, then their mood can be affected as well. But it's so much more than that. It has, its own enteric nervous system, its own nerve system, whereby, you have coordinated muscular contractions that work within there. But additionally, I think that nowadays it's easier to understand the gut brain connection because of the symptoms that can happen. We have a lot of folks who have brain fog, for instance, who have difficulty with word recall, or maybe just aren't as sharp as they used to. And sometimes it can be as simple as something that you ate that didn't agree with you, just because there is that gut brain connection. Now, I'm not going to bore you with any of the science, but for me, I love to think in terms of, just like the clinical outcome, meaning what is it that you feel? What is it that, what symptoms do you have? So, back when I was not doing well, I had a gluten sensitivity. I had a reaction to gluten. It wasn't celiac disease, but when I ate gluten, I didn't just have gastrointestinal symptoms. I also had a lot of difficulty thinking. I was having trouble completing sentences. I would reverse letters when I wrote. And I realized that these were not normal symptoms. I even walked into walls. That was just kind of the neurological component of gluten sensitivity that I was experiencing. And it concerned me to where I did consider seeing a neurologist. And I went to Toastmasters to improve my speaking abilities because I realized they were just going down the hill. Luckily, I had improvement just by cutting out the gluten. And Dr. David Perlmutter has a great book called Grain Brain that talks about how gluten can cause so many different issues, not just cognitive symptoms, but higher cholesterol, gastrointestinal symptoms, and the list goes on and on. Now, with that being said, does that mean that everybody has an issue with gluten? No, but that's just an example of kind of that gut brain connection. And I would say because we live in busy times, we have so many different things to do, it can be easy to be disconnected from your body and your symptoms. But your body talks, and it can tell you, if you listen, what's going on, because everything is connected. And that's just kind of like a general, simple way that I look at it.
Awesome. And so kind of gets my wheels spinning about one of the things that we hear with patients so frequently is about how they fluctuate. And, I think a go-to in my first response is, well, how well do you sleep? How well do you sleep? Or, is it allergies? But it really sounds like Certainly the gut is not my area of specialty, so it's probably, it's not my go-to, but it does seem like that's a conversation that I need to be having. And since it's not in my area of specialty, is there something that I could do, like ask people to keep a journal? What's something that we could ask people to do to see, kind of monitor that?
I- That's a great question. I think number one, just observing, being mindful of what's going on in your body. See how you feel after you eat, for instance. Do you feel overly full? Do you start to have some congestion when you eat? Do you start having acid reflux? And I think a lot of times we pay attention to the symptoms that really make us feel uncomfortable, but there can be some subtle things. Like, for instance, if your pulse goes up a significant amount after you eat, it's possible that you may have a reaction to something you just consumed. So it can be subtle, and it doesn't mean that you have to keep track of your pulse and your blood pressure and everything. I think it's just more about knowing that our bodies can talk, and maybe we focus on things like eating in a mindful way just to see if we're having any symptoms, instead of, say, eating in front of the TV, which I like to do, but without having like the additional distractions. It can be helpful. Maybe instead of eating in front of the TV every single meal, maybe once a week, you just sit at the table without TV, without the phone near you, and just see what your body is saying. And I would say it starts with that.
All right. And how would you describe symptoms associated with what you just mentioned of acid reflux?
So acid reflux is interesting because we have symptoms that we know of, like, say, heartburn, where you feel kind of burning in the chest, or you feel a movement of food refluxing up. That's the classical way that we know of acid reflux, contents from the stomach moving up, basically moving where it should not, coming back up. However, I have seen patients who have silent acid reflux, and they may have symptoms that aren't obvious. They may just come in with recurrent upper respiratory infections because they keep burning the tissues that they're trying to heal, or that their body is trying to heal. They can have cough when they lie down at night, because if you think of yourself, and stomach contents, your lower esophageal sphincter, which is between the esophagus and the stomach, if it has a tendency to open, then it's going to be worse when you're in a supine position, lying down. And that's actually something that happened to me. I years ago had acid reflux in the form of coughing at night because things came up and I started coughing. Other times you can have just irritation, a sense that something is stuck in the throat, or just burning for unclear reasons. So there are definitely so many symptoms, and I would say there are a lot of things that you can do, not just dietary changes. Gluten can be an issue for some people. There's caffeine, tobacco, tomato-based foods. There's also, I'm forgetting one, there's alcohol, but another area that a lot of people don't realize can cause acid reflux is magnesium deficiency. I see a lot of magnesium deficiency in my practice, and I'm not the one who came up with it. It was actually a patient who told me that another practitioner had healed his acid reflux by telling him to supplement with magnesium. Apparently, the magnesium deficiency allows that lower esophageal sphincter to loosen up and allow contents back up a lot easier. Now, it makes a difference which magnesium you supplement with, but the way I look at it, I think about, okay, how many symptoms does this person have of magnesium deficiency? In my practice, I see a lot of constipation. So magnesium deficiency can cause constipation. It can also cause insomnia, or at least contribute to it, because there are a lot of causes of insomnia. It can contribute to anxiety. It can contribute to headaches. It can contribute to muscle pain and aches. So, taking a look at everything, it's a good idea just to figure out, okay, how many different types of magnesium deficiency is this person exhibiting? And, in certain cases, I would say I most often recommend glycinate because it can help with sleep and it can help with anxiety. But in the case for, a lower esophageal loosening, I would probably use malate, which is really good for muscles, just all of that muscular function in the body. I use citrate for bowel movements if somebody is very constipated. And then threonate if somebody really needs kind of that brain calm, where they're just so anxious, they just need it to cross into the blood-brain barrier.
Awesome. Those are some great takeaways. Thank you very much. Now, a lot of what we deal with, what we're seeing is more like physical symptoms, dizziness, balance issues, even feeling weak and tired. But the other side of that is also the mental. You've already mentioned it, this overall mental well-being associated with our gut. So before I ask you some questions, kind of on the dizziness, balance, neuro side, share your thoughts about the gut and mental well-being.
Yeah, absolutely. I alluded to the neurotransmitters also being produced, or at least some of them being produced in the gut. And I have seen some patients who have gut issues have subsequent mood issues. And yes, there are times when the mood issues precede the gut issues, but I would say one of the main things that I like to recommend for mood is number one, just kind of seeing what somebody's day looks like. Is this somebody who is always doing things and doesn't rest? Is this somebody who's sleeping well? Because obviously, if you don't get enough sleep or you don't get enough quality sleep, it can affect your mood. Are you getting sick regularly because somebody who just has chronic congestion or just has difficulty breathing or any of these bothersome symptoms doesn't usually feel as well. So there are just so many factors that come into play. And yes, in terms of the gut, what I think about is, okay, is this person being exposed to pro-inflammatory foods? Now, going back to my example, and I apologize if I'm using this example too much, but the gluten sensitivity caused so many different things for me. It actually caused my depression. I was on medication for depression for many years. When I got off of gluten, the depression went away, which was very, very interesting. I also had any sugar cravings go away within 2 months. And, it just made a big difference because sugar is something that's pro-inflammatory pretty much to everybody. Does it mean you can't have a treat here and there? No, it doesn't. In fact, I don't like to completely decrease the quality of life for my patients or recommend that they just are so strict that they don't have any good quality of life when it comes to food. Food can mean a lot for us. And I think, we have to be reasonable with our recommendations and our expectations. So I think limiting sugar can be helpful because if it's causing inflammation in your body, it can cause inflammation of the brain as well. That can lead to cognitive issues, but it can also lead to some mood issues as well. So anything that you react adversely to, usually I see more gluten causing the mood symptoms and not as much of the other food items causing the mood issues. But I would say, it might be a good idea, when you sit down, that say one time a week, to see how you feel. I mean, do you feel maybe more depressed or you just feel more full after eating? And do you have the same zest for life? Because if you don't, then that might be a clue that you may need to look at your diet for possibly something contributing to your decreased quality of life.
Nice. Thank you. And thank you for sharing your personal story. I mean, that's very, very meaningful. So I appreciate that. In I wanted to let our listeners know is, we jumped on to make sure the audio was working just before we got started. And you mentioned something that I hadn't expected that you also really take a deep dive on, and that is the impact, not just gut health, but dental health. So I didn't anticipate to talk about that, but it sounds, I'm really interested to hear what you have to share on that.
Yeah, absolutely. So the mouth is part of the digestive system. And so anything that affects lower in the digestive system can be affected by something going on in the mouth. And the patients that I see, my clinic is called Gut Mend. So basically, most patients who have gut issues come to see me, and a lot of times it's after they've already seen their primary care doctors, after they've already seen their gastroenterologist, and they're still not better. So something is being missed. Now, I look at a lot of different things, not just digestion and elimination, but my question is always, well, what was going on around the time that these symptoms started? Sometimes I get clues to what maybe an originating cause is, sometimes I don't. But the two areas that I usually see cause originating or are originating causes include dental issues and emotional stress issues. So, in talking about the dental issues, there is a practice of biological dentistry that is made up by dentists who have gotten regular training, but they've gotten extra training to understand how their procedures affect you. So, for instance, silver, if you have any silver in your mouth, it may not be causing an issue, but if it's corroded, then you could be swallowing it and it could be causing problems, neurological problems, especially. I've seen it cause redness, like a red tint. I've seen it cause tremors. It may potentially cause imbalance. So, that's one area. But again, if you have any dental metal, that doesn't mean it's causing any problem. The question is always, okay, is this potentially causing an issue? Because if we're trying a lot of things and you're still not getting better, then we may have to be a little more aggressive about looking things up. So that's an area. Root canals are another area that I look for continued infection in. And there was a dentist by the name of Hal Huggins who did some great research and wrote books about this. There are also organizations like the IAOMT. I wish I remember it's something International Academy of Oral Medicine and Toxicology, I believe. But they have such wonderful resources talking about how dental root cause can be affecting your health. And obviously, it can cause gastrointestinal symptoms, but we talked about the gut brain connection. It can cause cognitive symptoms as well. Or even just taking a tooth out. There are times when there might still be an infection. Or if you have gum recession, or if you have continued pain somewhere, those are areas I like to think about. And when I do a physical exam, I look in the mouth. I look to see if the insides of the cheeks are inflamed. Do they have a lot of teeth marks? Are there lines or thrush showing yeast infection? Are things red in the back showing maybe somebody has a lot more acid reflux or has acid reflux that they didn't know about? I can see evidence of postnasal drip. There's so much information, and the tongue also gives me a lot of information. The tongue and the nails, to me, are very, very important areas in physical exam that can give me clues. In fact, I was researching this morning because I had an interesting nail finding on a patient yesterday, and it's just amazing how much information we can get. So, unfortunately, a lot of the findings, like the nail findings and the mouth findings, aren't something that I was taught in medical school or in residency. I had to seek this out later because I needed help figuring out what was going on with the body. In the society we have today now, when you go to the doctor, they just don't have enough time. They don't have enough time to really do as much as they would like. And a lot of times they have to rely on testing. But testing has its limitations and it also has its disadvantages. You can find things that you don't really need to worry about. You can also not see things that you need to see. So false positives, false negatives. And so this is kind of a time where I think going back to the physical exam can really help, but it's not just practitioners who can know about that. We can have a lot of folks that, just find the information or take a look at something on their hands by noticing what's going on with the body and maybe look that up. So I know that was a long answer to the
No, it was
dental
great.
question, but these are just basic things. And one more thing I wanted to mention about dental health. One of my favorite things to recommend, something that's simple that can really improve oral health, is oil pulling. Oil pulling has been around for many, many years. I believe it's an Ayurvedic, kind of more of a treatment or prevention. And basically, what you do is you put a little bit of coconut oil in the mouth and you just swish it around for anywhere from 2 to 20 minutes. And the important thing is you spit it out in the trash, not down the sink, but down the trash, because you don't want to swallow it and you just basically want to dispose of it, but not clog up your pipes. So, so it's a great way to just kind of keep things healthy and fresh and clean up that area as well, not just of bacteria, but maybe some other things that you may not need in the body, because the oral microbiome is important to the overall gut microbiome as well.
And is that just standard coconut oil or
Yeah.
special drops? Okay.
I just recommend the regular coconut oil. There you can do cold pressed sesame oil, you can do sunflower oil. I've seen those alternatives work pretty well. And then there's also a product if you have something more serious going on. Say for instance, I have a patient who has several root canals on the side that they have concerning issues, then I might recommend something with ozone. There's a product by Pure O3, and that's PURO3, that's called an oil pulling solution, which has ozone in there. And you can always add that in, say, once a week, and it makes a really good difference with the oral microbiome.
All right, that's great. And I know some of you came on a little late. This is being recorded and will be available, and I'll be adding the resources when I post the video of all these great takeaways that you shared. So, I was learned about functional medicine really through patients, of course, having like People's Pharmacy in town, and I think Austin's a great place to have introduction to functional medicine practitioners. And then I became very interested in it as I began to see more research on the impact of or the importance of our gut health on neurological disorders. And more recently, I've seen more on specifically to help Parkinson's related symptoms. Um, how is that connected?
In regard to Parkinson's disease and other neurological diseases, I think there are definitely things to consider. I would start by saying, it's important to realize that there might be exposures that somebody's having that is causing harm to the neurological system of the body. And I would say maybe that's a great place to start when you have something, whether it's a dementia, Parkinson's disease, or some other type of neurological condition. So some of the basic things that I like to recommend. First, I like to recommend a gluten-free diet for 3 weeks with the subsequent reintroduction 3 times a day for 3 days. Now, with neurological conditions, it might need to be extended, preferably to like 3 months, something around there, just because it can take a lot longer to see if there's a connection. And the reason I like elimination diets is because it's not expensive, in comparison to checking a test. Plus, you have to find the exact immunological reaction in a test. It could be IgG, it could be IgE. There's so many different reactions, and not all tests test for them, which is a problem. So you can have a false negative, but you could also have false positives. And really what I think does the best is, just seeing if you have a reaction. So you may not notice when you take away the gluten, but when you reintroduce it, it could be as subtle as nasal congestion after you eat it, or maybe a little bloating after you eat it. And those are signs that can help kind of determine that. But again, with neurological conditions, it may need to be extended at least to 4 weeks to see if there is some kind of connection. The other thing is just, decreasing sugar. Sugar is something that's very pro-inflammatory, and sometimes we have to really limit it temporarily during a time of major symptoms. Heavy metals and environmental toxins. There is a significantly higher rate of Parkinson's disease in farmers who were exposed to farming chemicals. And what I found is that a lot of patients, especially Parkinson's patients, seem to lose the ability to sweat. So our bodies get things out naturally. There's a component of breathing things out, but in general, you pee things out, you poop things out, you sweat things out. When you don't have one of your elimination routes working well, that's a huge problem, and things just circulate. The body was meant to heal itself. The question is always, why isn't it? So getting somebody sweating can be really, really important in the process, especially with neurological conditions. And sometimes I'll recommend infrared sauna, or just anything that will get somebody to sweat, even if it's a warmer bath, for instance. And one other component related to neurological conditions has to do with EMFs, and those are electromagnetic fields. I don't think they affect everybody in the same way, but when it comes to my patients with neurological conditions, I do ask that they do some basics to help decrease their exposures to EMFs. There are just a few things considering, unplugging the Wi-Fi router at bedtime, putting a cell phone in another room for sleep, or if somebody needs it for an alarm, putting it on airplane mode, off of Wi-Fi, off of Bluetooth. So just a couple of basics, because those can make a major difference. Now, I'm not the one who has the research and just the intelligence to explain the details of that. I have a friend by the name of Dr. Carlos Ritter, and he does EMF home testing. This is one of my most intelligent friends. He's a pediatrician who has gotten training in sleep medicine and physics, and he's had so much training. And basically what happened is that he noticed when he mitigated the EMFs in the homes of his patients, especially his autistic patients. When he reduced their EMFs in their bedrooms, he noticed that their EEGs, or their brainwave tests, had significant reductions in brain noise. They looked so much better. Now, this is in autistic kids, and there's also another physician by the name of Dietrich Klinghardt who talks about this as well. If you want a basic guide, the non-tinfoil hat, I can't remember the name of the title of the book, but it's by Nicholas Pineau. And he has a great book that just, gives a great introduction on EMFs. And there are multiple types of EMFs, but, the radio frequency EMFs through cell phones can make a difference. And I've seen it even in a physician who had Parkinson's that would carry his phone on one side, and he seemed to have more symptoms on that side. So, the bottom line is there can be a lot of different things. And, even I don't want to say there's an absolute rule for everything, meaning that just because I see more patients who have neurological conditions be more affected by EMFs, does it mean that everybody has this, even if they have neurological conditions? No. I don't think so. I think it's important to get just the information. For instance, we talked about being mindful of your body's symptoms. See how you feel. Whenever, you sleep, maybe do a trial of just unplugging the Wi-Fi router for a week or so. See what happens.
All right. And I've heard great things from patients who have home grounding devices that they say it helps their chronic pain. It helps them significantly. So I'll have to include additional information on that as well. I know that I want to leave a little bit of time for question and answer, but I have one more topic you've mentioned several times: inflammatory. We're here, we talked about the gut, the dental. Um, One of the things that I've seen in the practice, the ear crystal thing, the positional vertigo is certainly still probably the most common peripheral inner ear thing we see. But what we see every day is what appears to be vestibular migraines, and which is this inflammatory response. So even if we think about things like Meniere's disease, the go-to is lower your salt. When really what I've heard from patients is decreasing their sugar tends to help them more than anything. So it's just this repeated kind of inflammatory. I was wondering if you see in your practice like any type of correlation between like gut inflammation and people who have migraines.
Yes. Well, it's hard to answer that question because most of the patients that come into my clinic already have gut issues and happen to have migraines. So it's hard to give you a clinical, or at least know which came first. Is it that the gut issues caused some migraines? Is that they are contributing? I have often seen migraines be hormonally related. And I mean, there are just so many facets to it. Number one, I think it's important to make sure somebody is magnesium repleted. And it doesn't mean somebody has to take magnesium. It can be as simple as taking Epsom salt baths, making sure that they're sleeping well, making sure that their circadian rhythm is okay, because a lot of times that is thrown off. And if you have either neurological conditions or migraines, it's good to make sure you have a little bit of morning sunshine and you get to at least have good sleep, preferably not as affected by blue lights.
Mhm.
You can avoid blue lights before bedtime, or you can wear blue light blocking glasses. But, those are just some of the basics. I just wish I could give you more of a correlation. I don't know. I'm not really sure. I have a lot of patients with gut issues. Most everybody has gut issues, and some of them have migraines.
Fair enough, fair enough. So before we kind of open up the floor, um, what I would love for our listeners to know is, you've already mentioned your practice name is Gut Mend, and kind of walk them through the process of how people can see you. And I'll type in your website here in the chat box as you kind of walk them through how you see patients.
Yeah, absolutely. So my practice is a micro practice, which means that I have the fewest things that I need in order to do my job. I don't like to have fancy things around me. I don't even have anybody else working physically at the location I'm at. When you see me, that's who you see, that's all you see. And I like to have patients come in for the first visit. In fact, it's a requirement because not only do I need to know what's going on with somebody, I also need to just see them in person because I get information from physical communication, the nonverbal body language as well. And I also get information from the physical exam. We talked about the mouth, how important that is, the fingernails. Obviously, I'll check the gut, check the thyroid. There's so many different physical aspects that can give me so much information, even if it's just making sure to trace somebody's inflammation. For instance, is the majority of somebody's inflammation from the neck up? Well, then maybe there's something going on here. So it's really important, in my opinion, to have an in-person first appointment. However, the follow-up visits can be virtual as long as, I'm not prescribing medications. Medications require an in-person exam at least once a year. But most of the time, I don't recommend any medications. And what I like to do is put everything, give people a box of tools to work with and see what they feel will improve them. I'm not here to force anybody to do anything. I have a suggestion list and I work with patients regardless of what they choose from that list, even if they choose nothing. My goal is just to, make sure to provide somebody with a guide to help them towards wellness. And I usually like lower cost options. So you mentioned the grounding pad. I still like to ask patients, are you taking off your shoes and your socks and going outside and touching the dirt? I know a lot of people have, a resistance, but sometimes it just takes a little corner that you've cultivated with no ants and no hard grass where you can just put a chair and just sit there. So, those are just some of the things that I like to do in general. And basically, you help to dictate the plan, meaning that, if you see me once and that's all you need, then great, because my goal is also to make sure that patients don't need me after a while, that they have all the resources that they need.
Awesome. I'm going to take a stab at answering these questions and then you can correct me on it because
Sure.
this is why we're having this webinar because these are the questions not only that I get in the clinic and I'm, trying to increase my knowledge around it. Um, but it's just it's what I've seen through the years more and more and more is chronic symptoms. It seems to be that almost everyone I see with chronic symptoms has a gut issue. When you start asking questions. So I'm going to take a stab at this. Don't be afraid to correct my response. So I'm curious about the connection between gut health and Meniere's in women. So my 2 cents, historically, when I learned about Meniere's, it was about an inner ear issue, a peripheral, like my hand out here, just a structure in the inner ear. But what I've seen is now we look at it as part of your immune system, not just giving medication that might stabilize the fluid issues of the ear, but looking at it, are you sleeping well? What's your stress? How are you eating? Gut health and managing those helps manage the Meniere's and seeing a lot of correlation in Meniere's, particularly with sugar intake increasing symptoms. So that would be what I would tell someone is like, I know there's an inner ear issue, but it's more than that. We have to think bigger. We have to think about your entire body, your mental health, your physical health. And what I have seen is it just seems that seems to be a lot of gut issues, whether gut is affecting sleep, because those two things to me go together, lack of sleep and gut issues and problems with chronic things that are chronic or and inflammatory. So that would be my stab at that. And that's why I ask you to come because it's such a prevalent topic or consideration in the clinic. And then we have, would like to ask a question on behalf of a friend who is suffering from fibromyalgia. Any word of wisdom greatly appreciated. She lives in New Jersey. We've got that. And I'm going to go ahead and combine this with the original question of interested in dizziness and unsteadiness. Again, on the dizziness and unsteadiness, what I've seen is fluctuations. And when people talk about fluctuations, why am I fluctuating? I think, what is there stress, anxiety, depression, sleep, eating, exercise? Those are the things that come to mind. And I call well, I didn't come up with it, but the SEEDS acronym, which is sleep, exercise, eat, drink, and stress. So those are the things that are go-tos for me to talk about. And when those things are fluctuating, you see dysfunction in any of those areas or inconsistencies, then I think it's harder to manage symptoms long term. And as far as fibromyalgia, to me, that sounds autoimmune. So I look for patterns in autoimmune disorders. And that to me is about inflammatory and how do we decrease the inflammation? How do we bring down the nervous system through all of these techniques? So I'm curious, as someone that this is out of my specialty, as I'm a physical therapist, it's my how I've evolved through the years in my story is looking at those things. I'm curious what your recommendations are or how I can improve or better talk to patients because these are the questions that we get on a daily basis.
Well, first of all, I have to say, I really like your answers, especially when it comes to looking at the body as a set of collective systems that work together. So, yes, it's important to think of everything as connected, that it's not just this ear separate or the inner canal separately. Everything can be affected by what you eat, the different systems. If your liver's not feeling very well, can all be affected. And I think the way that you put it together really speaks volumes, especially when it comes to pro-inflammatory exposures. Sugar is that easy target where that most people can reduce. And it doesn't mean that we have to shame ourselves for eating sugar or what we've eaten in the past. It's more like continuing to optimize without that shame, without that guilt. When it comes to the whole fibromyalgia, I do want to mention something that I see not just in fibromyalgia, but in a lot of diseases. And this includes emotional root causes. So let me give you a simple understanding. And this is something I learned from a patient early on in my practice. He helped to teach me because this person was having a lot of digestive issues. And it turned out that there was something figuratively undigestible in his life. And in fact, he was the one that fixed himself, came back and told me about it. He basically said, yeah, when I fixed my home situation or when I got that better and finally made decisions for myself, my gut started working. Well, I wish it were that simple every single time. And I love it when patients have that feedback for me to learn from. But emotional root causes can be a major area. So the limbic system or the emotional memory is that other area I look for. And it's because most people either have trauma or come from people who have trauma, have had trauma in the past. And there's a great book called It Didn't Start With You by Mark Wolynn. And I usually have most of my patients read it because it helps you to understand how intergenerational trauma can be passed down. And there are a lot of different emotional root causes to every single symptom and disease. So I have to look at that. Does it mean that everybody has an emotional root cause? No. But at the same time, it's good to think about it just in case. So, going back to, being your own detective and thinking about, say, when a constellation of symptoms started, it's good to look at what was going on with you around that time. But I do see some patients who were almost born stressed, either had like a really traumatic childhood where parents were screaming or something happened and they just ended up stressed, or they came out of the womb stressed. And that has to do more with, having that sympathetic nervous system dominance where your body's in this chronic fight or flight or freeze. And that also can be tied to that emotional limbic system as well. So I would say it's important to address that so that somebody is able to finally get out of that fight or flight mode. There's another book called Why Zebras Don't Get Ulcers by Robert Sapolsky, talking about how, the different physical aspects that happen when somebody is in stress mode. Now, the title of the book, When Zebras Get Ulcers, is funny because, he thinks about zebras, okay, there's a time when, you may be chased by a lion and you either die or you keep going. But if you're alive, then you should get out of the stress mode. A lot of people continue to be in the stress mode, and it can prevent somebody from healing because the body was meant to heal itself. But this may be one thing that prevents it from healing because it's either stress mode or it's rest, digest, repair yourself mode. And so if we can help people get into that mode, then they get to help heal themselves. But I would say limbic system dysfunction, sympathetic nervous system dominance, and all of those are fancy ways for saying if we can get people out of chronic stress, if we can help heal the intergenerational trauma or even personal trauma that people are going through, then that I think is a lot of the key to healing things like fibromyalgia because what I've been introduced to in functional medicine is that you can get over things. You can get over autoimmune disease. You don't have to have these things forever. And I firmly believe that's the case with everything, including fibromyalgia. But we have to look at things in a different way. We have to have creative solutions in order to be able to help somebody help themselves. And currently, because I'm so passionate about this emotional root cause part, I'm studying to be a family constellation facilitator. And it's a whole different thing, but it's a great way to work on that intergenerational trauma.
Excellent. And I think what you said just goes back to one of the questions about dizziness and balance and what we see when there's maybe high anxiety, we see more dizziness. And I'm not saying that anxiety is causing the dizziness, which came first. I don't meet many people who have dizziness that don't feel anxious about it, but it's the importance of having down regulating that sympathetic nervous system because if they are in fight, flight, or freeze, then we can't learn anything new when it comes to balance. And so we see unexplained falls, and it's such a huge part for us to get the best outcomes because when we're in fight, flight, or freeze, we're not in learn mode. We're in survival mode and not using our higher evolved balance centers. So if you find yourself, what I like to tell people, if you find yourself using a startle response, kind of like when you hold a baby up and their arms go out. If you are walking around in a startle response to sound or stimulation, then it's indicating you're in that fight, flight, or freeze. And we want you out of there so that you can use your higher evolved balance centers.
Yes, and Bridget, I do have something that I remembered. Something I learned in primary care is that a lot of people don't drink enough water. And sometimes it can be as simple as that in regard to dizziness and lightheadedness. The other thing is medications. Medications can also often contribute, especially antihypertensive medications. You're taking something to lower your blood pressure, then it may contribute to things. Now, I know it's not as much the vertigo or the benign paroxysmal positional vertigo, but it can definitely contribute. And another thing I see a lot more nowadays, people are needing more adrenal support and sometimes needing more electrolytes. It doesn't have to just be magnesium. It can be potassium. It can be even sodium. I had to tell somebody yesterday to take a fourth of a teaspoon of sodium in water because, she was having issues just with fatigue and lightheadedness. And I think it was kind of that adrenal system because your adrenal system is responsible for that fight or flight, the stress. It does so many things, but if you're in stress mode for a long time or you had a major stressor, sometimes it just needs that support. So just some basic things. Now, regarding like supplementation, I recommend, talking to your physician practitioner about that first, because there can be some issues like chronic medical conditions that have a tendency like to fluid overload, like congestive heart failure, kidney disease, liver disease that you have to be careful for, but just so that or have an idea of some other contributors that may be more simplistic than we think.
Yeah, and we certainly see a lot of people are on blood pressure medication, and we find that kind of orthostatic hypotension, that lightheadedness, when they stand up, not when they, not the dizziness when they lie down, or they get placed on an added hydrochlorothiazide for
Hmm.
their dizziness and they don't have the potassium replacement. Now they're on, so it certainly can be a complicating factor, and it's all about making sure, we're going back and talking to your doctor. So there's a question here from Anne. Is it good to drink alkaline water purchased or to make your own? I don't know how, or to drink a glass of water with a teaspoon of baking soda, kind of that sort of thing.
Yeah, great question. So nowadays, unfortunately, everything is contaminated, including water. Water has, gosh, so many different products, and, we just do the best that we can. And we hopefully allow our bodies, or hopefully our bodies are able to filter out what it doesn't need. Because, yes, even tap water nowadays, we have to be careful with. With that being said, there are times that I do drink, tap water. And I like to drink distilled water because you basically evaporate the water from the chemical soup that there is in our regular water. That works for me, including adding electrolytes, and even trace minerals. But I recognize that there are a lot of different options nowadays that work for other people. So alkaline water, yes, I think that can be helpful. Adding baking soda can, yes, help rebalance the pH. It's interesting because I didn't think that that was as helpful as it was before, in concern for alkalinizing the stomach acid too much or that environment. But in general, it seems to work for some people. And my thing is just seeing what works for you. It's kind of like the whole diet issue. I have not found one diet that works for every single person. It seems to be that everybody is different. And so I think this is the case with the water as well. My recommendation, try it out. Maybe just try buying some alkaline water and seeing how your body reacts. If you like it, keep doing it. Or if you prefer distilled water or RO water, I think that's okay. And something else I would add, if you like praying, pray to your water, thank it for, you know providing you with hydration and nourishment, and maybe thank your body and have it release what it doesn't need. Doesn't mean that you have to do this, but I really like to do that nowadays, and I think it can be very helpful.
Yeah, I just listened to an intention on the what you say to yourself and how the importance of how we talk to ourselves.
Yeah.
This has been a pleasure. I could keep this conversation going, so I think hopefully in the future we can get you back. Was recorded. Don't forget, I typed in how to get in touch with you, but I'll also include that information when I upload the video. So I thank everyone. It's been a pleasure, and I hope to see you soon. Thank you
Well,
all for attending.
thank you, Bridget. Thank you,
Thank
everybody.
you. Really appreciate it.